Hi friends, I am sure you must have seen of late Muhammad Ali, the great boxer of all time. He was suffering from Parkinson's disease. He had a tremor, he had a shaky limbs, he was walking with a stoop, his face was like just like a mask without any expression, and eyes were something like a frozen without much eye blinks. He would walk with a stoop and with a tremor. Everybody would get worried of his condition. This particular condition called Parkinson's disease. It's said that there are around 180 per lakh people around the world suffering from Parkinson. Maybe around 1 crore people are affected with this condition, and the incidence every year is around 8 to 18 per lakh. Men are more affected compared to female, and as we ages beyond 60, the chance of getting a Parkinson is quite high. Rarely they can occur in young people from the age of 20 to 50 as well. This is called a young onset Parkinson's disease. Some of them may run in families, various mutations are available. So there are various risk factors for acquiring the Parkinson's disease, like insecticide exposure, especially when people are using the insecticides for killing mosquitoes, for killing ants and various cockroaches, and all. You should be extremely careful. Sometimes this can lead to Parkinsonism or Parkinson's disease. The other risk factor is head trauma, head injuries. The clinical picture is characterized by something called a trap. There will be tremor, there will be a pill rolling tremor, 4 to 6 hertz, that is occurring 4 to 6 hertz per second, and they can involve either one upper limb, one lower limb, or both sides as the disease progresses. Then there will be rigidity, the limb will be stiff and patient won't be able to walk freely. The limbs, there won't be any arm swing, and the patient would tend to go festination. They would run in order to get the balance. So there will be akinesia. There will be patient will be slow in all the activities. There will be even in thoughts called bradyphrenia. They won't be able to think properly. There will be some executive function. The executive function, that how to manipulate and analyze and execute things will be impaired, and they will have problem with the eye movement. The eye movement will be slow, something like a slow saccades, and sometimes there will be mask-like expression. There will be seborrhea, some oily face, and the voice will be monotonous and soft. Their writing will be maybe illegible, or it may be micrography, small writing, and they won't be able to manipulate the objects freely, and will be quite slow. They won't be able to walk just like the other people of his peers, and there can be recurrent falls, especially as the ages, as the condition progresses. It said that there are around 40% of the Parkinson's disease would fall, and some people would fall maybe once in every week. The 10% might fall every week. So it's quite distressing that if patient falls, there will be other consequences related to fall, with a head injury, fractures, spine fractures, quadriparesis, and other various issues. Then the other thing is they will have postural instability. The moment they tend to stand and walk, they will be unstable. They would tend to fall, and if they stand for a longer time, they would get syncopal attack. They will be blackout. They would fall down and get injuries. So this is called the tremor, rigidity, akinesia, and postural instability. Of course, there are many such conditions which would look alike Parkinson's. It's called a Parkinson plus syndrome. Many of the syndromes are like a PSP, Lewy body dementia, corticobasal degeneration, multiple system atrophy, or some other rare condition like Huntington's, which is not so common in our place, and Wilson disease, that's also not very common. Then of course stroke can give us a Parkinsonism, various drugs can give us Parkinsonism. Especially we have been seeing lots of young people or middle-aged people coming with the Parkinson's slowness, like no expression, and they would be slow. They might come in a wheelchair and all. So the moment you see the history or the direct prescription, you would see a lot of levosulfuride. This is especially used for gas. So you should be careful when you take these. If the patient, if one is you or of your relatives suffering from this slowness, check the drugs. And of course you should consult your doctor in case if this happens. In that case, if those patients come to me, I would stop those drugs and I would just change to some other medication. And some drugs which is used for vertigo, for vomiting, various anti-psychiatry medication, and some other medication which is used for vomiting and all. Should be sometimes this can give rise to Parkinsonism. Okay. So then you would ask me how to diagnose this. The diagnosis is mainly by history and examination. You would see a patient who is coming to your room slow, maybe he needs some support, maybe he is trembling on one side, on both sides, and sometimes he is such slow that it takes more time to enter the room and to sit, and the moment he sits he just tends to fall back. So these are the classical picture, and usually we don't need any scan or other further investigation, but if you feel there is acute or abrupt onset, maybe you need a scan. Otherwise I don't usually do a scan for Parkinson's. Okay. Then of course there are various medication available: levodopa, anticholinergics, dopamine agonists, MAO-B inhibitors, amantadine, and other medications like seleglin, COMT inhibitors are also, many drugs are available to treat Parkinson's disease. But we have to tailor according to the age of the patient, according to the profession, according to the whether it is a tremor, whether it is slow, whether he has got behavioral issues, whether he has got psychiatric comorbidities, whether he is seeing, whether hallucinating, whether he has got bladder dysfunction. So we have to tailor according to the functional disabilities the patient is suffering. Then of course, once after some time the drug would lose its effects, called waning effect or wearing off phenomenon. Sometimes the patient would be suddenly they would be slow, called off state or off phenomena. Sometimes the patient would develop this sort of a dyskinesia, something like dancing like so dyskinesia, or if there is not a medication, they have some fixed position called dystonia. So various phenomena have been described. Then of course, there are various non-motor manifestation of Parkinson like behavioral abnormality, depression, apathy, anxiety, psychosis. We have this sleep abnormality, REM behavioral disorder. They would get up, they would thrash in the cot and during sleep, they would even hit their spouse or the bed partner. So that is called a REM behavioral disorder. Various pain syndrome, shoulder pain, neck pain, low backache, osteoarthritis, complex regional pain syndrome, getting various pain, sensory symptom, coldness and pain in the feet has been described, constipation, various sexual dysfunctions are all part of the illness. It's as a part of package. It just comes up as a package. There is motor problem, there is a non-motor problem, there is a visual problem, there is a psychiatric problem, there is a gastrointestinal, there is a genitourinary or a skin abnormality. So many things would come in the bracket of the Parkinson's disease, right? So if the drugs are not effective or the patient is experiencing various sort of troubling manifestation like a dyskinesia, like tremor, this sort of movement, then the next option would be a deep brain stimulation. You can put some micro leads or electrodes into the brain parenchyma, the basal ganglia, the subthalamic nucleus or the globus pallidus or thalamus and all. Then you can give pulses of the electric pulses, so that would improve the clinical condition called deep brain stimulation. It is slightly costly. The other option, we can put a pump called apomorphine pump. You can put just like the insulin pump, you can give a continue infusion of a subcutaneous infusion of a drug called apomorphine. This would also give very good results. So in short, Parkinson's disease is largely treatable. We have medication available. We should do physiotherapy. Various exercise programs can be done. You should also treat any comorbid psychiatric or physical manifestation of the Parkinson's, and you should always look out for other conditions like Wilson, Huntington's or other Parkinson plus syndrome. Very rarely this will be drug induced, so you have to remove those drugs. Rarely it can run in families, various mutations are there, but I have seen only a couple of cases which runs in families. That means those things are extremely rare. So you don't have to worry that whether if my father is having Parkinson's, would I get? The answer is no, because it is such a rare. Maybe there is around 2 to 3 fold increase in the families. Otherwise, we don't expect that father getting a Parkinson's, sons getting Parkinson's. It's very unusual. So don't worry about it. Okay. So what I would like to drive is that Parkinson's disease is common in the population. It can be treatable, eminently treatable, and various drug things there. Various pumps are available. deep brain stimulation is available, is largely treatable. That is a good point. Sometimes the coffee, tea would give a better improvement with in Parkinson. Okay. So if you have got any comments or questions, you are always welcome to do so. And thank you very much. Bye.